Hi, I'm Dr. Chanel Hierman, and I'm very happy to be here speaking with you today and honored to have been asked to be part of this group here. And so without further ado, let's get the slides up on the screen for you. Okay, so today we'll be talking about building connection with technology, innovations in creating health and happiness. My name is Dr. Chanel Hierman, and I was asked to speak here today because of my telepsychiatry experience. I'm the founder and director of Synergenius Telepresence, my private practice, and I'm also a telepsychiatrist over at Aspen Point in Colorado Springs. I'm also involved in a number of organizations for both integrative medicine and telemedicine, as you can see here, and I have some faculty appointments as well. So let's talk a little bit about my background in integrative medicine. I've actually been involved in integrative and holistic medicine ever since medical school when I was in charge of the holistic medicine interest group, and I just went on from there. I wound up getting my certification in mind body medicine and then completing an integrative medicine fellowship and getting my board certification in both integrative medicine and integrative holistic medicine. I also teach integrative medicine as part of my job at the faculty at the Saybrook University College of Integrative Medicine and Health Sciences, and I also work as guest faculty at the University of Arizona Center for Integrative Medicine. So I'm pretty well versed in what one of my colleagues used to call that touchy-feely medicine that you do. Interestingly, though, I'm also kind of a nerd. I've got quite a long technology background. I used to be that med student that was beaming my patient notes by infrared to the printer at the nurse's station back in the day. I've been doing websites and social media and all sorts of stuff like that over the years. And I've been doing telemedicine since about 2006. Telemedicine I'm defining here as delivering medical care over video conference, and telepsychiatry we'll define today as basically psychiatry done over telemedicine. I've personally set up telemedicine and telepsychiatry programs in 2 different countries and across 4 U.S. states, and that includes public mental health settings. I also do some electronic medical record consulting work. I'm right now working with HIMS here in Arizona, and I've done some past work with other EMRs and online health platforms as well. So here's the big question. How do we build connection with technology? How do we get some soul into the machine? How do we make our technology serve the actual human beings that are using it? The way I created my connections was starting my private practice in 2010, combining both telemedicine and integrative psychiatry. It's called the Synergenius Telepresence, and it's named for the synergy between the various conventional and alternative practices that I use in my treatments. I focus on women's mental health, but all genders and gender expressions are welcome. And my services are available in 6 states, including here in Arizona, but also New Mexico, Colorado, Wyoming, Nebraska, and North Dakota. And in my practice, I focus on comprehensive, individualized solutions to help busy women overcome their mental health struggles and get their lives back. So I also create connections to their homes. Patients in my practice are actually seen from the comfort of their home or wherever they'd like to be seen from. It's a simple video conference platform, actually the one that we're using for this meeting today. Just one click to join, and it winds up feeling a lot like an old-fashioned house call. I wind up meeting their kids and their pets, and you can kind of see how their house is and just how things look for them as a person. You get a much better picture of them clinically. You get a lot more information. This practice is very busy and very popular with very busy women. As you know, most women are very busy right now because they're doing a lot of work in the home and outside the home, and that leaves people with not a lot of free time, and especially moms are really stretched thin. So this helps to take some stresses off. When you do telemedicine in this way, you don't have to worry about taking time off work. People can just close the door and nobody even knows you went to the doctor. Privacy is a huge bonus. Nobody sees your car parked out front of the psychiatrist's office, which in a small town can be a big deal. And someday we'll be in a day and age where that doesn't matter anymore. But for right now, that's still a thing that matters to people. Nobody has to worry about finding the office, finding parking, bad weather, or finding babysitters. It just really saves a lot of stress. My business model is direct to consumer, so it's a fee-for-service cash-based model. I don't take any insurance or Medicare or Medicaid. I do have a sliding scale, though, because it's really important to me that this be accessible to all sorts of people. I don't want integrative medicine to be this like niche practice that only the rich and famous can have. I want everybody to have this kind of good care. That being said, I'm also a big fan of person-centered care, which, as most of you know, means that everyone is different and gets a unique treatment program. So even without considering the financial issues of a direct-to-consumer program, this isn't the right setting for everyone. For example, folks with serious mental illnesses or people who are in acute crisis really need a more comprehensive wraparound support. support. Having a solo psychiatrist on a video, possibly located far away, isn't always ideal when folks maybe really need a center with, social workers, case managers, therapists, nurses, a whole team of people who are dedicated to helping them get well. And so I frequently will refer folks back to their community mental health agencies, because those are the folks that are really set up to handle this sort of thing. Folks who are in serious financial struggles, very low socioeconomic status, I also find often do better in the community mental health setting, just because caseworkers have a lot more training than I do in helping people to access community services that could benefit them. And that's really what social workers do, and we don't learn that in medical school. I love doing community mental health telepsychiatry. Right now I work at Aspen Point, which is a community mental health center in Colorado Springs. It's actually got a dedicated telemedicine staff and location that's specifically for that, which is great, because then it gets to be like a team approach, even though a lot of us are working virtually. I really enjoy the diverse population in a community clinic, and I enjoy giving back and, as I said, making sure that this work is accessible to everyone. So why do this over telemedicine? Why not just have all the doctors be right there in the clinic? The number one benefit is that it improves access to specialized treatments like integrative medicine for underserved populations. I grew up in a small town in Nebraska, and it was at least 5 or 8 hours drive to the nearest specialist that you might need. And this really eliminates a lot of those kinds of problems. I've also practiced in rural areas, and I know what it's like to be a practitioner in an area where you can't always get easy access to specialists when your patients may need that. So this helps to take care of some of those concerns. The biggest issues that people bring up about telemedicine, the worries that people have is this a real relationship? And is it equivalent to in-person care? And also, is it good for patients as well as providers? Fortunately, we have solid evidence. The answer to all of those is yes. There's effective, and the evidence shows that telemedicine is both effective and acceptable in mental health populations. So for telepsychiatry, the outcomes are consistently comparable to in-person treatments, and there's a high level of satisfaction for both patients and providers. And that includes some studies where actually the patients preferred the telemedicine to the in-person therapy. It's been shown to be satisfactory for a wide demographic of patients, including the elderly, which isn't someone you necessarily always think of when you think of telemedicine, but it's really gotten a very wide acceptance in the geriatric psychiatry and nursing home populations. There are loads of studies, a few of them are listed here, but like I said, the VA has been doing this for 30 years. Over 300,000 veterans have been served by telemedicine, and this has all been studied very thoroughly. There are loads of studies out there. If you feel like hunting that down, it won't be hard. The question that comes up most often, though, is the telemedicine relationship, and I really want to make sure that we spend some time on that, because I want to focus on the fact that these are real relationships with real human beings. Just because one of the human beings happens to be behind a screen doesn't make it not a real relationship. And so I wanted to show you one of my favorite things, which is my little stuffed puppy here, and also my pretty bracelet here. And these were gifts from patients at the last clinic that I used to work at right before I left. And these are people who had never set foot in the same room as me. And yet I mattered to them enough for them to bring me a gift to say goodbye. And they mattered to me. We were real human beings having a real relationship that just happened to be virtual. So changing gears just a little bit, we're going to talk about my group program. I've been doing groups for a very long time, and because I really believe in the power of groups. They have a lot of benefits. They minimize the cost barriers because there's less of a time cost when more people are seen together. It maximizes the personal connection time because people actually get more time with their doctor than they would otherwise. And I believe it actually maximizes the benefits. We are more powerful together, and I feel that groups heal in a way that one-on-one treatment can't always duplicate. Why do the group over telemedicine? Well, it's easily delivered to wherever the patient is. If you deliver this into the home, you can this allows busy people to fit self-care into their lives. And for other settings, this allows access to group support for underserved patients who otherwise wouldn't be able to attend, either because of a rural location or mobility issues, transportation issues, all sorts of reasons that might keep them from otherwise being able to participate in this important and valuable support. My group program is based on my book, The 7 Foundations of Health and Happiness, Building a Bridge to Balance, which they have been kind enough to carry here at the conference. And basically, the 7 foundations, as I'm defining them, are rest, movement, nutrition, self, relationships, work, and meaning. And those are the things we really look at more closely in the group program. It's designed to be a system for the real world. This is about a core message of letting go of perfect and aiming to do enough. Enough is how I'm defining it in all the key areas of your life. The goal is not to be so awesome at some area and then let all the other areas of your life go into neglect. You really want to do a little bit in all the important areas, and that's how you stay balanced, and that's how you have the most positive impact on your life and your happiness. So why doing a group program? I mean, I do still teach the 7 foundations in a one-on-one setting. It's still very helpful. People really seem to enjoy it. But I did find that as I taught it to people one-on-one, a lot of people wanted more support in applying the 7 foundations to their lives. And sometimes it is more impactful to have group support and accountability when you're trying to make life changes. And because of that, group support has the power to do much more than we could otherwise do on our own a lot of the time. So that's how my group program was born. This was also influenced by my training at the Center for Mind-Body Medicine, which is a model that is founded in groups, and that is the key to one of the things of why their program works so well. The group curriculum that I follow is an 8-week model, focuses once a week on one of the 7 foundations, and then the final week is on behavior change, so how to make this really stick. Each week includes homework from the book, a slide presentation, and then foundation resources like handbooks, MP3s, so that people can work on this at home. We actually tested our group program in a pilot study. We did this in a rural public mental health clinic in Colorado, and the results were published this summer in the Journal of Technology and Behavioral Science, which I'm really proud of. The results, we got a ton of results, so I'm just going to go through the most interesting ones here. The qualitative results showed themes of the program providing practical information on how to deal with stress, improving their communication and relationships with their loved ones, contributing to their quality of life, and interestingly, that people commented positively on the cohesive and supportive group atmosphere. And I thought that was especially interesting because it was, in fact, a telemedicine group, and people were still able to create connections right there in the room, even though the facilitator was offsite. The patient satisfaction results were also interesting. All of the participants, every single one, rated the group program as very satisfactory overall. We also had a complete lack of dropouts from our group. And if you've ever led a group or been part of a group, you know that for the most part, the people you end the group with are far fewer than the ones you start with. But in this case, every one of them stayed, and that meant a lot to us. The results specifically regarding telemedicine, we asked people a bunch of questions about the telemedicine experience in particular. We got overwhelmingly positive responses for all the different aspects. And when we asked people specifically, did the telemedicine therapy experience feel real to them, we got a unanimous yes. So why does this matter? Why would we care? That's because telemedicine can bring quality healthcare to everyone. It serves remote and underserved areas, it reduces cost, and it creates connection and social support, which I believe could act as an antidote to the epidemic of loneliness that it seems to be plaguing our society right now. I really believe that telemedicine group programs will be key in allowing us to provide integrative medicine for everyone. So logistics, tips, and best practices. Here are some tips for people who might want to be trying to do one of these groups on their own in their own clinic. There are a couple different location models. You can do one where the facilitator is off-site and the participants are together in the meeting room. That's what we did for our study. Or everyone separately in their own homes or offices, and everyone dials in kind of like a video conference. And honestly, they both work. I've done both. They both work well. It just depends on the patients and their preferences. Key lessons for implementation and logistics regarding the room itself. You may need to modify the group setup versus how you do groups normally if you're doing groups in your practice. I would recommend 6 or fewer participants unless you have a really awesome webcam. With our webcam, if we got more than 6 people around that long conference table, I couldn't really see the faces of the people on the far end. It also helps to utilize a talking object like a talking stick to pass around. That helps to facilitate order and also participation among all the members. Other key lessons regarding the technology, this should go without saying, but here we are, invest in high-quality technology to enable smooth function of the group and facilitate better rapport. You want high-speed internet, you want a high-def webcam, and you want a freestanding microphone for the originating site. You do not want the audio to sound like a newscast coming from a war zone. You know, hey, Bob, how are things on the ground? This is not helpful for growing rapport. And specifically, just so that you guys know, the originating site is in telemedicine, that's defined as where the patients are, and the far site is where the provider is. So other key lessons, communication. You really need excellent communication between the originating and the far site. That's super important when you're trying to do something like this. You want to ensure that all the necessary materials are prepared in advance. You want to make sure that the handouts are where the patients are. You also want to make sure that you've thought of safety in advance. You want to arrange the safety procedures before you begin the group. In our group, we actually had someone available on site by text message, so I could actually text privately without even necessarily being seen on the screen if something was escalating to the point where we needed some help. We also had safety planning materials. If you guys have any particular like RAP programs or things that you use in your clinic, it's good to have those papers on site because that does come up in the group. And clinically, the key recommendations are don't be afraid to modify the group process or the curriculum to accommodate the cognitive needs of your group. The goal is to meet people where they are. This is person-centered care. Tips for modifying the group for people with serious mental illnesses. We actually had a large number, if not the majority of our group members had a serious mental illness, and many of them had chronic or severe concrete or psychotic thought processes, which required us to work around it just a little bit. Sometimes you had to be a little more active in expanding the depth of the check-in. So here are some helpful questions that we found that helped to kind of bring out more than just fine from people who were checking in about how their last week had gone. Things like, how did you spend your time last week? What was your favorite and least favorite part of the week? Is anything stressing you out? Those kind of things will help get people thinking about what they can talk about. I also recommend providing examples for most of the exercises because that helps people to understand the purpose of the activity and helps make it more meaningful. I also highly recommend holding groups for mixed diagnoses. It can be a very positive experience for everyone involved, and there's no contraindication that I can see. Subject to people being able to participate fully. As long as they can engage with other human beings and do some abstract thinking, they should be really okay in a group like this. And one of the really magical things I see that happens in these groups is that people realize that it doesn't matter whether you're there with your chronic schizophrenia or your chronic PTSD or your chronic depression or whatever it is that's brought you into the group, that what we have in common as human beings is so much bigger than the labels and the diagnoses that we have. And that itself is one of the great lessons from the group. Ideas to consider, in addition, is to include a second round of check-in to assess their homework, hold people accountable for actually doing the homework, and also facilitator participation in all activities where I trained. That was considered just part of what we did, and it set the tone for the group. It allowed us to show people kind of what it was like to share in an appropriate way. And the biggest one is be flexible, don't sweat the small stuff. Motivated clients will likely still have a positive experience even if issues arise. We had problems with technology, location, scheduling. If it could go wrong, it did. The internet went out, the AC went out, all the things went out, and the people rolled with it, and they stayed in the group, and they kept working with us. If you come there with authenticity and a really genuine desire to help, people are willing to work with you even if something goes haywire. So the only real trouble with telemedicine is, as you can read the caption, and now inhale deeply, Mrs. Saunders. So I would not recommend doing a cardiac or a pulmonary exam over telemedicine, at least not using this equipment. So with that, thank you very much. I appreciate the opportunity to come speak with you today, and feel free to email me later on if you have any further questions. And I look forward to the question and answer. Thank you so much for having me.